Colleagues, it's after 11 o'clock on Sunday night, and we've just witnessed an historic event on television. Because regardless of whether you are for or against the health care reform debate, you have to be proud of AOA's involvement and Optometry's engagement in what is an historic event for our profession. We're up against insurance industry, we're up against organized medicine, and people with deep pockets and groups that were looking to put barriers between our patients and the care we provide to them. And yet now we're standing on the era of a new era in health insurance and health reform. The Harkin Amendment, which we battled for every step along the way in this past year in this legislative process, is the first ever federal non-discrimination statute. It applies equally to insurers, whether they're ERISA plans or not. There are many plans that have outmoded views, even in 2010, of optometry and the care we provide, and they would seek to put barriers between our patients and our practices. And yet, through people like Senator Tom Harkin, with his pro-access and pro-patient agenda, insurers have to look at us differently now. They have to look at us as what we are. Optometry on the front line of eye health and vision care. Together, we've achieved something historic. We've achieved something that is on a level with what happened in Medicare 25 years ago, with us achieving parity. And yet, as significant as this work is, there are other safeguards that have happened. For example, existing vision coverage is safeguarded through standalone vision plans. There's also no preemption of state insurance laws. There's the creation of state-based insurance exchanges to provide health insurance for the uninsured. There's the creation of a new designation for a children's health benefit. There's emphasis now on the healthcare home model, not the exclusionary medical home model, which did not recognize optometry. We've got exemptions on eyeglass and contact lenses from a new medical excise tax, and also for the cost of vision benefits from the calculation of a new excise tax on high-cost health plans. At a time of great change and great uncertainty among healthcare providers and patients, the inclusion of these important AOA priorities in healthcare reform is crucial. It helps our patients, it helps our practices, and it helps our professions. I'm thankful to all of you out there who are engaged in this whole process along the way. I'm also thankful to the AOA staff. It proves how effective we can be when we all work together to help proactively determine and define our profession for our patients. Thank you for all the work you've done. You'll be hearing from AOA President-elect Dr. Joe Ellis shortly.
Good afternoon. This is Dr. Joe Ellis from Benton, Kentucky. I'm back home now. I've been seeing patients this morning in the clinic. I just saw just a few hours ago President Obama signed into law the National Health Care Reform. Again, this is the biggest piece of legislation that this country has seen since the mid-60s with the passage of Medicare and Medicaid. I'm happy to report, as Dr. Brooks has already reported, that the AOA, through their tireless efforts of our national and state affiliate leadership, also through our advocacy group leaders and through the federal key persons, and also thanks to the AOA PAC investors and other concerned doctors of optometry who took their time to come to Washington at a short notice to talk to people in Congress. And also I want to thank the optometry students from across the country who have come to Washington to stand up for patient access and the importance of our state laws in the national health care battle of our lifetime. And the AOA did prevail. Our organization mobilized as never before to become a force in the Washington, D.C. battle over national health care reform, and the AOA-backed patient access provisions, including in this final bill, show that to be a fact. I'm very proud of the role optometry played in making vision care for kids an essential health care benefit. I'm also proud, too, that millions more Americans will gain access to their local doctor of optometry because this new federal law will now target the discriminatory practices of health care plans. Also, I'm proud to say, on a personal basis, I'm proud to see now that the discriminatory practice of ERISA will now be a thing of the past. I never thought in my professional career I would see the discriminatory practice of ERISA overridden with federal law. I'm also especially proud of the work we've done in optometry with some of our friends in Congress, especially Representative Mike Ross of Arkansas, my good friend Representative Ben Chandler from the state of Kentucky, and also other pro-access leaders in Congress to preserve existing state-based patient access to care laws. Although this victory affords an opportunity to appreciate how optometry's advocacy efforts have progressed, it does not mark the end to our profession's fight for patients and to proactively defend our future. As this healthcare legislation is implemented, every optometrist and every optometry student must be prepared to provide even more determined advocacy for optometry in the capital at Washington, D.C., also in the state houses, also in the media, and also in the ophthalmic community. And especially we need to get our message over to employers and payers of healthcare in this country. Again, a very big day for optometry. This anti-discrimination language, again, will open the door of access to millions more patients in this country. Again, we have a lot of work to do with the implementation of healthcare reform, and we look forward to meeting that challenge in the future.